recommendations of the CDC to reduce transmission of COVID-19. The rule is effective immediately. The Board of Health has authority to enact this rule for the protection of public health and to prevent the spread of communicable diseases under Montana Statute 50-2-116. At the same time this face covering rule was enacted by the Board of Health, the Missoula City County Health Officer, Ellen Leahy, signed in a very similar companion order under the authority of Montana Statute 50-2-118. In summary, the rule requires use of masks or face coverings by all employees, volunteers, and members of the public in all indoor settings to which the public is required or invited to enter. It includes transportation, such as bus, cab, car service. It applies to all individuals ages 12 and older. It does not replace the 6-foot distancing recommended when the public is present. The rule provides for a few individual exceptions for the safety of wearers or impossibility of wearing, such as health conditions, or the individual when eating or drinking. The rule and order is available at the city and county websites and is being sent to the media as part of this press conference. There's been a large amount of public support. County staff briefed the Board of Health on this public support and public comment immediately before the meeting. My understanding is we had well over 4,000 comments submitted on this rule. At the time of our Board of Health meeting, over 2,700 of those comments had been processed and logged in by county staff. They simply ran out of time to get the entire 4,000 plus comments logged in at the time of our meeting. But the 2,700 plus comments, in overall, 81% of those comments were proponents of the rule. 19% of the comments opposed the rule. Broken out by city versus county, in the city of Missoula, 87% of the respondents were proponents of the rule. 13% of the respondents were opponents of the rule. In the county, 67% of the respondents were proponents of the rule, and 33% of the respondents were opponents. Again, altogether, the comments were 81% proponents and 19% opponents. Now, a number of our community leaders are here today to express their support of this rule and order, and each will provide some brief comments if they would like. We've got Josh Slotnick, Chairman of the Missoula County Board of Commissioners. We've got Mayor John Engen, the Mayor of Missoula. We've got Ellen Leahy, Missoula City County Health Officer. We have Rob Watson, Superintendent of Missoula County Public Schools. We have Seth Bodnar, President of the University of Montana. We have Dean French, CEO of Community Medical Center. And we have Grant Keir, President and CEO of the Missoula Economic Partnership. So Josh, I don't know if you want to get us started.
Thanks a lot, Ross. So I just want to start this by speaking towards where we were a few months ago. Back in the springtime, we saw the numbers of cases rise here just like everywhere else, and things got pretty scary. Our governor closed things down. Our health officer made sure they were closed down in a way that was appropriate to us, and we saw the number of cases drop to nothing. And we opened back up, and now we have seen cases rise to a level that are greater than they were back in the springtime. We realized that it's untenable to remain as we are right now. It's also untenable to have our economy completely closed down. So this, to my mind, is our first best crack at coming up with a way to be open and safe. So I'm really excited we were able to do this unanimously. I'm thrilled about the high degree of comment, over 4,000 comments. And it's our best hope that in a month at our next health board meeting, when we look at this, we'll see that this has worked.
Right,
Thanks all for your contributions.
thank you, Josh. Mayor Engen, do you want to chime in?
Thank you, Mr. Chairman. I appreciate that. I appreciate your leadership, that of the board, and Ellen and her department. The commissioners and I wrote a letter probably better than a week ago, as time flies, asking for this order to be put in place, and staff, I think, prudently, wisely, and thoughtfully put together an order that makes sense for our community. This is a common sense step forward during a time when this virus is on the rise, not on the wane. And it provides consistency throughout the community, gives businesses guidance, creates a level playing field, and creates expectations in the community that we can all acknowledge and move forward with. Masks are easy. They just are. They help. They make a difference. We can't find the silver bullet, so we're cobbling together solutions as we can and as necessary to make this community safer. This is a great step in that direction. I'm grateful to all of you for your support, and I'm grateful to the community for its support as well. And we'll keep plugging.
All right. Thank you, Mayor Engen. And I must say that your letter was very, very well received, and Josh as well. Your letters were very well received and very appreciated. I very much appreciated those letters, and I think we all did. And we tried to move to action on them. We were all thinking the same thing at the same time. So thank you very much. Ellen, do you want to?
I just, you know, I speak with my colleagues across the state, and they are we have so much support, and they recognize that in this community to do some of the really hard things to do and not step back from them, not be afraid to change course. And it's, you know, this is just another chance. This isn't an easy lift for anybody. We will continue to appreciate your support and your scrutiny, both. And I hope this helps everyone who has been trying to do more with masks and needed your support to do so. Thank you for that.
All right. Thank you, Ellen. Thank you very much. Rob Watson, Superintendent of Missoula County Public Schools. Would you like to say anything to the community?
Yes, I would, but I can't unmute my camera for some reason.
We can hear you well.
I don't know if it's something on my end. Oh, it says video sharing is disabled by the administrator. So that's not me in this case. I can speak to this though, just while we're figuring that piece out. So we at Missoula County Public Schools support the mask order. We believe that it's going to be really critically important if we're going to go back to schools in some sort of safe manner, that we as a community have a handle on the numbers and hopefully see some decline in those numbers. We believe that the mask order will help with that. It's our goal to have students back in school in some sort of fashion in just a little bit over a month, and we want to do so in a safe manner. And we believe the masks will help with that. As we read guidance on school reopening, one of the big things that we're seeing is that it will be very difficult to socially distance in schools. We know that. We have a finite amount of space, and we know it's going to be difficult to socially distance. So when we can't socially distance, masks are even more important. So we appreciate the commission and the city for taking this action. We support it. I understand that there was quite a bit of discussion about the age, the 12 or more. In the order, we support that as well. We believe we can develop policies and procedures for our students that are under the age of 12. Thank you. Sorry, I couldn't turn my camera.
Thank you, Rob. Really appreciate that insight. Seth Bodnar, president of the University of Montana. Would you like to speak to the public?
Yeah, I just want to start by thanking once again the leaders on this call. Over the past several months as we've navigated this, I have been and continue to be deeply grateful for the partnership, the collaboration, the support that I've seen among community leaders in addressing this pandemic. This is not something at all that we can address in our various silos, and this leadership team continues to come together in very impactful and productive ways to protect the health and safety of our community. And I, both as a leader in this community, but also as a citizen in this community, I have deeply appreciated that. Like Superintendent Watson, we at the University of Montana have a very important educational mission. And we're going to continue to take steps to ensure we can accomplish that mission while protecting the health and safety of course, our University of Montana family, as well as the broader community. It's clear that widespread use of masks is key in mitigating the spread of COVID-19. And we've been working hard to ensure that on our campus. In doing so, we've been working with leaders here in the Missoula community and also across the Montana University system. As you may be aware, our plans for the fall are being developed and they're being operated within the guidelines of the established by the Montana University System Healthy Fall Task Force. And as many of you may have seen, that task force recently announced their recommendation for a mask requirement on campuses across the state. So we at have been supportive of a mask requirement on campus. And so we're, of course, pleased to see this recommendation and are working together now with the MUS Healthy Fall Task Force to finalize those guidelines regarding specifics around scope and enforcement on our campus and other campuses across the state. And those will be reviewed by the Commissioner of Higher Education soon. And we're, of course, supportive of the action taken today by the Board of Health. And I think it's important, though, to also make an additional point that while, of course, rules and regulations are important, ultimately our ability to mitigate this pandemic is going to be dependent on behavioral change and cooperation of members of our community. And I want to echo Ellen's comments about the appreciation for members of our community to take this on. And I want to point out that our students as well are taking a proactive and a responsible approach as well. Our student leadership has been in the process of developing a pledge that students on our campus will sign to indicate their commitment to take the necessary actions, not just to protect themselves, but also to protect others around them and to protect the broader community. And I think that's an important point for all of us to remember, that we're in this together. And so there's an important role of leadership through this, and then there's an important role of community membership in this process. And I look forward to continued partnership and collaboration with those on this call and across this community as we navigate this challenging situation. So thank you.
All right. Thank you very much, Seth. Dean French, CEO of Community Medical Center. Would you like to speak to the public on this?
I would just like to thank the board for their recommendations and standing up these recommendations in our community. As a leader of one of the two major healthcare systems in the city, I think both our facility and St. Patrick's are really happy to see this next step. We're concerned, obviously, about the spread of COVID in our community, and we know that masking is one of the simplest and most effective means of preventing spread, particularly in indoor spaces. We've been masking in our facility since the middle of March, and it will be nice to see the rest of the community joining in on that effort. I view this as protecting our public, protecting the integrity of our healthcare system so that we're not straining our capacity to the place where we're not able to take care of the people we're accountable to as a healthcare system. But I also see it as an economic decision, because the simple act of masking, I think, is the simplest way and to preserve our ability to maintain our business and economic environment in Missoula County. 30% of the folks that went out on unemployment were in our service industries, and now they're back at work. I'd like to see them back at work. That is good for the health of the community too. Missoulians are social animals, and we need to continue to be able to be out and participating as a community together, but let's do it safely. So thank you for the leadership that this moment represents. And I think Joyce couldn't join us today, but she would echo our gratitude. Thanks.
All right. Thank you, Dean. And Grant Keir, President and CEO of Missoula Economic Partnership. Grant, would you like to speak to the public?
Yes, thank you, Chairman Miller. So data and anecdotal information from our local small businesses that are struggling to survive right now clearly show that Missoula's economic health recovery is dependent on people both being and feeling safe from COVID health threats in their own workplace and in the places that they go to conduct business. The vast majority of feedback that we have received from local small businesses on the topic of face coverings has very much tracked with what I think we saw from public comment on this ordinance, which is a vast majority expressing a request explicitly for a mandatory mask ordinance of some type. One of our founding fathers, Benjamin Franklin, wisely said that an ounce of prevention is worth a pound of the cure. Face coverings while indoors is an ounce of prevention that embodies the wisdom of our founding fathers. During COVID-19, community health is the foundation of our economic health. We are all grateful at MEP to the health department for listening to the broad feedback that came from our community and taking seriously your role in protecting public health and really giving us the best shot at economic recovery as quickly as possible.
All right. Thank you, Grant. And with that, I guess at this point, we'll open it up to questions if there are any.
I have one.
Go ahead.
Yeah, yes, sir. This is Peter Christian from KGBO Radio, and I just wanted to read something out of the enforcement level that we heard earlier today. And it says the rule order directed at businesses and operators of indoor public spaces. And point 2, it says the idea is to regulate indoor spaces, or I should say it does not create an individual requirement, and therefore an individual who refuses to wear a mask cannot be subject to criminal penalty under this rule or order. So I was wondering if one of you could address that and help us to understand how that will help folks to comply.
I see that Anna Conley is on, I believe. Anna, and Anna's a county attorney, deputy county attorney. Anna, do you want to address that question?
Thank you.
Yeah, I don't know if there's a more specific question, Peter, that you have other than restating what I stated earlier.
Well, it just doesn't seem like there's much of an incentive to obey this if there's no possibility of penalty for not obeying it.
Yeah, as a deputy county attorney, I can speak to our enforcement options and not the policies behind those enforcement options. I also don't speak for law enforcement and what their plan is or their capacity is with regard to enforcement.
Can I try and jump in on this, Peter? This is Josh.
Please do. Thank you, sir.
Sure. So yes, individuals aren't going to get tickets. The idea here is that businesses will comply with a health order in the same way that licensed establishments comply with health orders now to make sure that their kitchens are sanitary, et cetera. So if someone is in a business and they're not wearing a mask, it's actually the business's responsibility to ask them to put on a mask or ask them to leave. If the person then doesn't want to comply, then the business owner could call 911 in the same way that if someone went into a store with no shirt on and wouldn't leave without putting their shirt on. This is on the owner of the business or the manager of the facility, not on the individual in terms of who would receive the enforcement. Does that helpful? I don't know if I hope
yes,
trying
sir,
to.
that's very helpful. Thank you very much.
You bet. Thanks, Peter.
And I would just add, as with any law, we do depend on the majority of our neighbors and our citizens on complying. So we do try to stop at the stop sign, even if the policeman isn't there. So we are, I think I stole that from Josh, actually, didn't I? Yes, I did. That was a good one. So there is, still a responsibility for people to take safety precautions and precautions that protect others, just as there are in so many arenas. And we are relying on the goodwill of the members of the community that usually will do that.
Thank you.
And I'd just like to say for the record, while Ellen may try to stop at stop signs, the rest of us actually come to a full and complete stop.
Yeah, yeah. Thank you for that.
Yeah. All right. All right. Any other questions in our time remaining?
Yeah, this is Ed at Montana Public Radio. Two quick ones. I believe Bighorn County was the first county to do this. Does this make Missoula the second? Does anybody, A, know that? And B, Ms. Leahy, could I get some clarity on what schools can do with kids 12 and younger, or if they have mixed classrooms? I just want to make sure I know what's going on there.
Well, we are the second county. Bighorn, with their situation, and when you look at what they're facing and how small they are, and they didn't have some of the support of some elected officials, and when you look at them stepping forward, both the tribe and the local health department and health officer, I really, really commend them for being the first to do that. So yes, we are the second. We did have a health officer's order that was still in effect. It actually still is, but this encompasses it. When we opened salons more slowly than the governor's directive allowed, we did put a masking requirement in the health officer's order there, because to do that service, you are necessarily within 6 feet of each other. But as countywide, I am aware that others of my colleagues, their boards, this was the second time the board took this up. I am aware of other boards that have taken it up the first time and are looking at taking it up as early as next week. In terms of schools, I think Ross said it best. We recognize, I mean, when you look at U of M, that's a school and more. It's a university and more. It's a gathering place. It's all of those things with different ages and different things going on. Perhaps less so in our local schools. However, those actually, their facilities, their locations, how the children and the teachers are arranged, their other abilities all have to be taken into consideration. And so I think what the chairman said earlier is we're not trying to prescribe exactly how they do that. But if a 12-year-old should be protected going into a grocery store, we do not see a reason why a 12-year-old shouldn't be protected going into the school.
So it's left up to individual schools, is that right?
From that age and below 12, yes, correct.
Got it. Thank you.
Yeah. So basically the rule and the order stop short of developing specific policies for specific schools. Those schools are responsible to comply with the order and the rule, but they have the flexibility within their own policies to determine just how they do that. Do they want to do it by grade? Do they want to do it by middle school? That's a school decision, so long as they comply with the rule.
Thank you very much.
This is Martin Kidston with the Missoula Current. I'm wondering, perhaps Mayor Engen or Commissioner Slotnick, if the Sheriff's Department and Police Department will perhaps release maybe weekly numbers to show how they're responding to these calls, how many calls they get, as a sign of compliance, and also a sign to maybe reflect how this impacts their workload. Is there a way to track those responses?
Martin, let me just toss something out. That, like I said earlier, this is on the store to ask a person to put a mask on or leave. The police are only going to be involved if that person refuses and really puts up a fuss with the store owner, which I can't imagine happening very often. I don't know that what the statistics you're looking for are going to be reflective of stores' compliance.
Okay, thank you.
Yeah, you know what we'll do, Martin, is I will get some anecdotal feedback certainly as things move forward. We would code these calls based on a violation other than the health order because we're not enforcing that order. So we would likely respond to a disorderly conduct or a trespass or something to that effect. But I'll quiz the chief occasionally to see if we're seeing much in that regard.
Complaints and questions from the regulated community and from the public should come to the health department. Our environmental health division and our public information group has been working in that mode since the first local health officer orders back in March, through the governor's closure, the different large group gathering orders, all of that. And again, the first call should come to us, and we are going to try to work with that business owner or school to see what will work for them.
Thank you.
Any other questions by the media?
Yeah, this is Maritza with NBC Montana, and I'm just wondering, how does this work in a restaurant or a bar? Because I can envision a lot of people saying, well, I'm drinking every 30 seconds. I'm not going to wear a mask the entire time I'm in there. Are there kind of some guidelines for what people should do in those kind of settings?
Well, the rule does recognize that if you're eating or drinking, you can't have your mask on. But we would ask people to do, if you're sitting around waiting for your order, or standing at the door, or sitting afterwards and having that nice discussion afterwards, have your mask on. The servers will have their masks on, if in compliance, at all times.
Thank you. Any other questions?
Yeah, this is Cameron Evans with the Missoulian, and I apologize if this was addressed earlier. I just wanted to make sure I'm clear on it. I was curious about like large office spaces, where you might have, let's say, like 20, 30 people in an office and you're sitting relatively close by. How would this be enforced there?
So if they're not, everyone in that building, if is open to the public, and there's public present, has to have a mask on. And they should also stay 6 feet apart. But we recognize that often people can't stay 6 feet apart and get the job done or move around. So this requires that the mask is on. The recommendation for staying 6 feet apart, and in some places the requirement under local order, still is in place. Now, if they have a conference room and they want to have a meeting, the public isn't present, it's their staff meeting, they need to be at least 6 feet apart. But at that moment, in that particular setting, they do not have to have the mask on.
Okay, great. Thank you.
All right.
Alan, this is Maritza one more time. I just want to clarify, if a business owner or operator is fined, I know initially it would be a warning. If it gets to a fine, it wouldn't be less than $10 and not more than $200. Is that correct?
I think that's, yeah, we don't usually do fines.
Okay.
This is Anna. So there's two paths to enforcement. There's a civil path in which you would seek judicial enforcement of a closure order should you go through the outreach, you go through the warning, you go through the closure order, and you still can't get compliance. The fine is a misdemeanor fine if someone is charged criminally after being cited by a law enforcement officer. So those are the two separate paths. And I think like Josh said, I don't anticipate that law enforcement will be citing people under that misdemeanor statute. There are situations where, as Mayor Engen said, you could have a disturbing the peace or a disorderly conduct where you have someone who may be violent, or have another situation that is a crime in and of itself where you could have law enforcement involvement.
All right, thank you. Any other questions? All right, hearing none, I think we can call a wrap on this press conference, and just can't tell you how much I appreciate this and how it's been a real, makes me feel good about our community that we're all able to pull on the same, just be working on the same side of the fence on this and doing the right thing for the community. It just,
Yeah. That's
feels
great.
good in the face of a bad feeling time.
Yeah. Thank you.
All right. Thanks, everybody.
Thanks, everybody.
All right. Bye now.